there. Welcome to the Pelvis Project podcast. I'm Megan.
And I'm Roxy. We're two pelvic health experts brought together by passion for our careers, entrepreneurship, motherhood, and the desire for intentional relationships.
Join us in our mission to spread pelvic floor awareness and start conversations surrounding the truth behind genuine health, imperfect wellness, and joyfully navigating life. We are so glad you are here with us.
Let's start the conversation.
Hello, Roxy.
Hello, Megan.
All right. Well, we are going to dive right in. We are back for our next episode, and we're going to keep the ball rolling with men's health, as June is Men's Health Month. And so today we are going to talk about men's pelvic pain and talk a little bit about how that shows up, touch on that topic a bit. In fact, just before we hit record, Roxy and I are both just jabbering about our male patients that we've had here recently, and just fascinating. And so many of them that have been dealing with things for a very long time, and nobody has ever actually fully assessed or pressed in certain areas, which, I mean, obviously it's a very vulnerable situation to have to go into. However, we're doing a disservice if we are not providing this type of assessment or care. And we know that it is uncomfortable. We know that it is not fun or ideal or what men particularly want to do, but it is extremely important. And we just want to encourage, if you're a pelvic health provider listening to this, if you don't treat men, it's a very underserved population in the pelvic floor arena. If you are at all interested, I would highly suggest it. So Roxy, why don't you start us off and talk a little bit about what is male pelvic pain?
For sure. So pelvic pain is basically just pain occurring anywhere in the region between the belly button and the thighs that persists for more than a few weeks or months. So it doesn't just have to be genitalia, but a lot of times that's what a man is he's going to complain of, is pelvic pain, whether that's a scrotal pain or maybe people will call it the taint between like the scrotum and the anus. It can even kind of be like rectal pain. But really, it's just a big global term. And some common diagnoses that we actually see, or that the doctor might diagnose this person with, or that we'll see it on the referral, is...
I was just getting ready to say, listen, Bram can be on this episode.
Okay.
Roxy is a working mama, so everybody hears the baby, it's good.
If you hear grunting or little giggles, that's Bram boy. Okay. Some common diagnosis that we see that, or the patients tell us that their doctor has given them, is chronic pelvic pain syndrome, or we'll see like a chronic prostatitis. Sometimes we'll see pudendal neuralgia. Obviously, pelvic floor dysfunction is going to be one that maybe someone is told that they have testicular pain. But the main point of just this, like thinking about the definition of pelvic pain, is that a lot of these men are told, okay, well, your prostate looks normal, or your scans are normal, or everything looks fine, yet things aren't feeling fine. And so normal testing doesn't necessarily mean that symptoms are imaginary or are fleeting. We often see that men come in kind of frustrated because they have been told one thing but are feeling quite the opposite.
Yes. Multiple tests come back fine. And of course, that's frustrating for anybody that's been in pain. So what symptoms can men experience? And I think that a lot of people don't realize the way that this can all present. But like Roxy mentioned, testicular pain is very common. Penile pain, pain at the tip of the penis. Perineal pain, they'll say, like, I feel like I'm sitting on a golf ball. So kind of right through, like Roxy mentioned, what that space that is sometimes referred to as like the taint. That could be very tender. Tailbone pain, groin pain, lower abdominal pain, and hip pain. So all of those can be like pain symptoms or where you're experiencing that. So you could also have with that urinary symptoms. So you can have urgency, frequency, hesitancy starting your stream, a weak urinary stream, or feeling like you're unable to completely empty your bladder.
And I'd add to that, sorry, I just had a patient today that he described his stream as like if his thumb was over a hose. Like,
Uh-huh.
you know how you spray a hose and you put your finger, your
Yep.
thumb over it? It was deviated off to the side. And so that kind of goes along with a little bit of that like weak stream, but it was actually more of a forceful stream. It was just off to the side. So I wanted to kind
Yeah.
of add that in
And I
too.
know that that happen I mean, obviously, we have that happen in females too, so it's really interesting how that can be, like, just a little bit of a indication of something going on. So, sexual symptoms, obviously, we've got pain with erection, pain with ejaculation, erectile dysfunction, reduced pleasure, and then, post-ejaculatory pain. That's a question that's I ask often is if they mark pain with ejaculation, I'm like, "Is it" I always ask, "Is it during or after?" And listen, all of these things here, like everybody gets a little bit like kind of embarrassed or they want to talk about this. This is the stuff that like we've got to know. And I always like to point out, like, I cannot do my job if we don't know these things. So we have to talk about it. And then bowel symptoms, constipation, pain with bowel movements, and then feeling of incomplete emptying. All of those are also symptoms that happen when we have this kind of whatever sort of pelvic pain that we're kind of talking about.
So let's chat here a little bit about why does pelvic pain then happen? So the first big reason that we see, or the first big kind of objective finding that we notice, is that the pelvic floor muscles are overactive. And if you've listened to any of our episodes, you know that how we feel about this idea that the wrong assumption is made when there's pelvic floor symptoms and thinking that the pelvic floor is weak. And so go back. I'm sure we have lots of episodes about that. But basically, we can't make that assumption. In men with pelvic pain, typically there's a tension component where the muscles are way too tight and they're pinching down on nerves and structures, and that does not feel well. And so those muscles often are tight, or they're guarding from other pain, or they're just overactive and they're unable to relax because the patient might not even notice how tight they are. We can't obviously know everything that's happening with our pelvic floor just by thinking about it or sitting still and noticing. And so a lot of times this is really frustrating because they don't even recognize that that's happening. But thinking about like if you sat there and clenched your fist all day long, you would feel like trash by the end of the day. Your hand would. It gets tired. It's painful. And so the pelvic floor then behaves the same way when it just is clenching all the time. And then we're trying to move, we're trying to have bowel movements, we're trying to have any type of like pelvic function down in the pelvis, or just walking around and lifting and doing our day to day tasks. Then when we work against that clenched muscle, that can be terribly painful. Then so number one, just to recap, overactive pelvic floor muscles. Now, the next thing that we tend to see is nervous system sensitization. And so it basically means that our nervous system starts to become more protective of us. And so the pain signals become amplified. What used to be maybe a weird, uncomfortable sensation that's fleeting here and there now becomes constant and really loud and really painful. Things that contribute to this, that might not be what starts it, but definitely what contributes to it, are chronic stress, any previous injuries, surgery, and along with surgery comes scar tissue, history of an infection maybe, or even just ongoing fear and anxiousness about these symptoms. So we tend to see this becomes a really sticky cycle where there's pain and then we have fear and feelings and stress about this pain, and then that causes our body to tighten up more and try to protect us. And then it just keeps going on, and we get into just this chronic cycle that's really hard to disrupt. And so thinking about then the window of tolerance, our resiliency for just simple tasks starts to tank, and the body is really grumpy. Essentially, if you think of us on a grumpy day versus on a normal day, we can tolerate a lot more when we're in a good mood. The littlest thing can set us off when we're grumpy, and that's kind of how the pelvic floor is. And so that pain doesn't necessarily mean that you're injured, because it's more of an alarm, but our body starts to think that pain equals tissue damage, and that causes it to guard and fear more. And so that's the second one. And then another one that we see is musculoskeletal contributors. And so pain might be existing in the pelvis, but it's actually originating from somewhere outside the pelvis. So the hips, the low back, the SI, the abdominal wall, even the adductors or our inner thighs, our groin region. All these areas outside of the pelvic floor can then be a contributor to that pelvic pain. And then we get more symptoms at the pelvic floor. And then last but not least, we see things like bladder, bowel, and other lifestyle factors. So things like constipation, excessive sitting, very high stress for prolonged periods of time, maybe things like poor sleep even, or heavy straining. And then also this, it might sound weird, but like a lack of movement or really sedentary positions where the body is allowed to stay in a tight and wound up position. And then when we do stand up to go to the bathroom or go get a drink or whatever, then there's quite a bit of pain. Well, then it causes people to want to sit more because then movement hurts. That's not a completely exhaustive list, but those are some of kind of the bigger reasons why pelvic pain starts and happens.
Okay, so what does treatment look like? And that we get that question a lot. And I think that's what keeps men from coming. So, a pelvic floor assessment would look like we would be assessing movement patterns, breathing, core function, pelvic floor assessment, bladder and bowel habits. And let me circle back to pelvic floor assessment. We can obviously assess externally. We have many tools in our toolbox, but one thing that is kind of a key little piece to the puzzle is us to be able to do a full pelvic floor internal assessment. And again, you do not have to do this. You can say no, but if you've been dealing with something for quite a while, it can be very helpful. And that internal assessment is done rectally in men. And it's definitely can be one of those things where it's no big deal. And it, again, if you don't have any pelvic floor dysfunction, it doesn't cause any discomfort and it just kind of feels funny. And then if you do have pelvic floor dysfunction, we can often reproduce your pain or your symptoms when we are pressing or palpating on the muscles of your pelvic floor through going rectally through kind of the rectal canal. So again, I think that we need to be talking about this more because that way it gives people a chance to kind of wrap their head around what needs to be done in order to meet our goals and to get rid of this pain. So treatment might include, different, obviously it's dependent upon the patient, but things like teach ways to lengthen and release your pelvic floor. There's different breathing strategies, mobility work, hip mobility work, nervous system regulation, vagus nerve, manual therapy to the muscles, visceral work, and exercise progression is often what that might look like. And then lifestyle strategies, we're going to be talking about things like improving sleep, reducing constipation, improving nutrition, stress management, walk regularly, avoid prolonged sitting. There's lots of different strategies. And we're not going to be providing good care if we're not addressing these lifestyle strategies because you could be doing all these great things and you aren't getting any sleep and you're burnout all the time. That's just going to drive more nervous system components to it. So, and then of course there's team-based care. So we're all about like having an allied professional, like a health professional care team. And so that could be a pelvic floor therapist, a urologist, if you need a pain specialist, a men's health provider, primary care. We can have multiple people on your team to help kind of determine what's going on.
And then let's just kind of chat here a little bit. So we've talked about how it starts and what we do with it, but how do we know when pelvic floor therapy is appropriate? And so just a couple of things that I want you to be thinking about if you're wondering that question is we really want you to reach out to a pelvic floor therapist and seek further evaluation and even just conversation or ask questions if you've had pelvic pain that lasts more than 6 weeks. I think we can see some really acute type of things that it isn't unwise to seek help for those. But definitely, if it hasn't gone away on its own at 6 weeks, it's probably not going to go away on its own. We also want you to not sit around on testicular pain without any type of explanation. If it just kind of shows up, that's a red flag or an indication that there's probably something more going on. Any pain with ejaculation, also persistent urinary symptoms. So we all have maybe experienced a little leak here and there, like with a cough or when we're unexpected or, if we have a full bladder. But if it's just becomes a trend, then that is a sign that we need to intervene. Any type of sexual dysfunction, if it's something off, if it's pain or delayed anything, right? Like those are signs that we need to intervene as well. And then just any symptoms impacting quality of life. I think if you're questioning it, it's probably worth it getting looked at. If you don't know or you're just uncertain, then that's also a good time to ask questions to whoever it is in your life that you feel confident asking those questions to when it comes to like a healthcare provider. So if it's your primary or your urologist or a pelvic floor therapist or whoever that is, definitely just ask more questions. And if they don't know, then hopefully that gives you the courage to ask someone else, or they can help find that out for you. So don't hesitate because these things can be corrected.
Yeah. So overall, just kind of the take home message, male pelvic pain is real and it's common and it's often very treatable. And so if you've been told that your tests are normal, but you still have symptoms, don't stop looking for answers. The pelvis is connected to muscles. There's nerves that run through your muscles in your pelvis, bladder, bowel, and nervous system. It's all connected, and addressing all of those pieces can make a tremendous difference. And we are here to help. So if this episode resonates with you, please share it with somebody who needs to hear it or pass it along to a friend, or if you're a female listening and you know a man in your life that's been dealing with stuff, please let them know. Men don't talk about pelvic pain enough, and it's time that we change that. And we'll make this part of our mission. So until next time, we'll keep this conversation going. So long and farewell. Thank you so much for joining us this week on the Pelvis Project podcast. Help us continue the conversation by liking and sharing this episode with friends. And if you really want to do us a solid, leave us a review. If you'd like to follow us on social, check out the show notes for links. And remember, this week, take a deep breath and relax your pelvic floor.